My name is Dr. Malinda Teague. I am the lead faculty for the Pediatric Nurse Practitioner Primary Care Program here at the Duke University School of Nursing. I'm also a practicing pediatric nurse practitioner. I practice in both acute care and in primary care as a dual certified PNP, and currently practice in primary care for Duke Health. The Pediatric Nurse Practitioner Primary Care Program prepares nurses to take care of children in the outpatient setting, both in primary care but also in specialty care. As long as you're in the outpatient setting where children are not likely to have an acute condition that could cause deterioration in the short term, then primary care training is actually appropriate for those families. We also take care of the entire family when we're taking care of children, because of course a child isn't there in their own self and by themselves. So we do pay attention closely to what is going on with the family, what's going on in the child's environment, with school, and all those other considerations when you're thinking of the overall health and wellness of a child. Our primary care program for pediatrics is part of the overall master's program here at the School of Nursing. So in the beginning of the program, you are also in courses with your other nursing colleagues in different specialties such as women's health, family nurse practitioners, adult nurse practitioner students. So you get a good range of other colleagues that you learn together with in the beginning of the program. After that, you move on to your pediatric management courses where you're with your soon-to-be colleagues in the pediatric world. It's a great opportunity for networking, for meeting colleagues who are going to be in other parts of the country, end up in different types of settings, and you'll find, if you talk to any of our alum, that they frequently consult with their peers who are now doing other things, and it's a great network of resources when you have a question of how to proceed with a patient. Things that make our program unique are, number one, we're very proud to announce that in the U.S. News and World Rankings, we were ranked the #1 pediatric nurse practitioner primary care program. And again, we're very proud of that. Other things that make us unique is we not only have a distance-based program, but we also offer what we call on-campus intensives. So you do come to campus a certain number of times during the program, sit in a class shoulder to shoulder with your peers, get to know Duke as a physical place, and also get to interact with our world-class specialists and world-class faculty who are here on campus with you during that time. The nice thing about the distance-based programs is it is intended for working professionals. So we know that adults are all out there working, they're functioning as nurses in their communities, they're holding leadership roles, they're doing all sorts of things, and the distance-based curriculum allows that to continue. It also allows you to meet the responsibilities that you have in your own life outside of work and outside of school, which we all recognize are just as important as the curriculum. We do feel that this sets you up to be successful as both a pediatric nurse practitioner, but in the process of being a student as well. Our program also requires 600 clinical hours, which is over the national requirements for pediatric nurse practitioner programs. And we feel this is important to allow you to get the experience that you need to be a confident practitioner and provide the best evidence-based care for your patients after you graduate. We also are proud to say that all of our pediatric faculty are practicing clinicians, in addition to being in the classroom, both in person and virtually. And that clinical experience brings a very large wealth of knowledge and expertise to the classroom, and we do feel that that's a very important piece of the program here at Duke. Another important piece that we include in our Duke program here is the focus on policy and how to impact policy as a professional. So our pediatric nurse practitioner graduates are out across the country doing this every day, not only advocating for their patients in the clinical setting and in their own practice, but also on the local, state, and federal levels, and even globally with things such as Shot for Life, which promotes vaccine access to countries around the world who don't already have it. If you have any questions about the program, I'd be happy to speak with you in person or over email. My contact information is on our webpage. You can also access the admissions office for questions about application process and all of those things. But we really are excited that you're interested in our program, and we hope to see you soon, and we hope to share our love of children and their health care with you.